Hi, I'm Igor, and today we will talk about aneurysm. Aneurysm is abnormal dilation in blood vessel more than 1.5x larger than normal vessel diameter, more than 3 cm larger in aortic and thoracic aorta. Frequently occur in areas of high blood pressure, aorta, femoral, iliac, popliteal, and cerebral arteries. Can occur in veins, uncommon. Pressure on blood vessel wall increase with diameter of vessel lumen. Laplace law. 60% of true aortic aneurysms occur in abdominal aorta and 40% in thoracic aorta. Most between renal artery branch and aortic bifurcation due to less collagen in this area of aorta. Location can occur in any body vessel. Particularly life-threatening in the following location is abdominal aortic aneurysm, abbreviation 3-big A, localized in abdominal aorta, diameter more than 3 cm or more than 50% larger than normal, or caused by atherosclerosis, infection, trauma, arteritis, cystic medial necrosis. Thoracic aortic aneurysm, localized in thoracic aorta, less commonly than abdominal aortic aneurysm. Cerebral aneurysm, located in brain, particularly threatening in circle of Wills. True aneurysm, all layer of blood vessel wall dilate. Fusiform aneurysm, blood vessel wall dilates symmetrically. Circular baryaneurysm, asymmetrical ballooning of blood vessel wall due to increased blood pressure on one side of blood vessel wall. Pseudoaneurysm, small hole in blood vessel wall, more blood leaks out, and pus resemble fusiform secular aneurysm. Causes of this disease is ischemia, infection, and genetic factor. Ischemia of arteries with vasa vasorum, hyaline arteriolosclerosis, decrease blood to large artery walls, decrease smooth muscle in arterial tunica media, and ischemia of arteries without vasa vasorum, plaque from atherosclerosis, block blood vessel wall from receive oxygen. Infection such as tertiary syphilis cause an inflammation of tunica intima of vasa vasorum and decrease blood to arterial wall in thoracic artery and arteritis obliterans. Mycotic aneurysm. Secondary infection in intracranial arteries, visceral arteries, arteries of extremities, bacteria enters vessel wall and weaken it. Pathogens include Bacteroides fragilis, Pseudomonas aeruginosa, Salmonella species, Aspergillus, Candida, Mucor, and also an infective endocarditis complication. Genetics disease such as Marfan syndrome, Ehlers-Danlos syndrome. Risk factor. White biologically male individuals of European descent, advanced age, and smoking, hyperlipidemia, hypertension, family history, Ehlers-Danlos syndrome, Marfan syndrome, syphilis, cystic medial degeneration, and bicuspid aortic valve. Complication. High mortality rate is rupture, internal exsanguination, increase intracranial pressure in brain, compression to surrounding structure, superior vena cava syndrome, aortic insufficiency, thrombosis, emboli, stagnant blood in extraluminal space, abdominal aortic aneurysm, rupture, bleeding can be retroperitoneal or into abdominal cavity, acute aortic occlusion, aortocaval, aortoduodenum, fistula, connection between aorta, inferior vena cava, duodenum, respectively. Thoracic aortic aneurysm, dissection, rupture, bleeding into thoracic cavity. Cerebral aneurysm, rupture lead to hemorrhagic stroke or subarachnoid hemorrhage. If large aneurysm can place pressure on surrounding cerebral tissue, causing neurological symptoms. Finding symptoms of aneurysm asymptomatic until rupture, severe pain in specific location, abdominal, chest, lower back, groin, pulsating mass, hypertension, and syncope, abdominal aortic aneurysm on rupture, pain in abdominal region, back, pulsating sensation in abdomen, low blood pressure, and syncope. Large aneurysm followed by pushing on abdomen. Diagnosis based on ultrasound and primary clinical symptoms. Ultrasound confirmed presence, location, and size, and motions growth. CT scan ac- accurately measure use pre-surgery. We see aneurysm of abdominal aorta, more than 3 centimeters, its diameter of 8.5 centimeters, and normal aorta compared to aneurysm. CTA scan. CTA scan injecting a contrast dye show blood flow used for surgery. Other diagnosis ECG to rule out myocardial infarction. Treatment is medication, pharmaceutical treatment for blood pressure management, surgical indication aneurysm more than 5 centimeter or more than 1.96 inches, or growth in 6 months more than 0.5 centimeters or 0.2 inches, or individual as symptomatic. Repair methods: surgical clipping, aneurysm clipped at base, endovascular coiling, platinum virus promote blood clotting, decrease blood flow through aneurysm, endovascular stenting, wire stent inside aneurysm, allow blood to bypass aneurysm. Other intervention goals initially prevent aneurysm rupture with regular ultrasound monitoring. Calls for individual receiving surgery for aneurysm maintain tissue perfusion, motor and sensory function, prevent complication, and infection, for example, infection and thrombosis. Calls for post-operative individuals maintain blood pressure, perfusion, especially renal perfusion, monitor urine output, peripheral pulses, capillary refill, skin temperature, abdominal gears, intra-abdominal pressure, and limb sensation and movement. Monitor stand graft patency. Thank you. Subscribe to the channel.